clinicians who are with us in our family. And when you combine it with tech, it takes patient care to a different level. Our beloved chairman, our vice chairperson, they always feel the same. And that's why Apollo has been in the forefront, and we do everything for our patients, and we are the first. Many examples are there when you talk about the robot, you talk about proton. Everything which we do, the center is the patient, and that's what we did. It was tough. I remember Dr. Venki was talking about 4 o'clock in the morning. I won't say 4 o'clock in the morning, it would start the previous day. Patients lined up. We were also talking to SSI Mantra on the last mile connectivity, because that's very important. You would want no slip-ups in the internet connectivity. We got in touch with Airtel. Everything was done in a seamless manner. And the most important thing is to see that smile on the patient's face. We all were talking about India as a country. Rural population is deprived sometimes of healthcare. And to see a smile on their faces, you talk about the attendance of the patient who's there getting treated, it takes and it makes you feel different. We've experienced that. And with Dr. Venki Munikrishnan's expertise, we've seen the program grow. You talk about Colorectal program, 1,000 surgeries, a big thing. Not only at one hospital, but you talk about the network of hospitals, he's been pioneering it. So that's remarkable. A special thanks to Professor Waxner, Professor Chan for coming here and always partnering with us. A special thanks to the media personnel who've come today. I think what is important is all of us as healthcare professionals and the media, where you will play an important role, let's talk more about this. There's enough good clinical talent which we have in the country. What we want is that the best goes and we pass on to the patients, and that's what our endeavor is. I would again like to thank my colleagues for being a part of this wonderful event.
Family support following a major surgery. So financially, what they pay for flights, hotels, whatever, they can pay for the technology. And this, in time, technology will get cheaper. But we want to drive that.
So you have done 10 surgeries, sir? 10 surgeries?
Yes. All for colorectal cancer.
Thank
Sir,
you.
if you don't have the hospital there,
Sorry?
if you don't have the hospital there in remote location,
Yeah.
do you have any plan to have a portable operation theatre?
Yes, that is what they're building. That is what they're building, a portable house. So the doctors, Vishwa showed, the portable roof in the Varamari, like a big bus, can be, parked in the remote location. And hernia surgeon connect பண்ணுவாரு, gallbladder connect பண்ணுவாரு. So that way, you can have the best of expertise delivered there. Although it looks futuristic, it is just a mindset change. When we have proof of concept and we've shown 100 cases, 200 cases, suppose ஊர்ல வந்து கன்னியாகுமரியில பண்ணாங்கப்பா patient நல்லா இருக்காங்க, 1 மாசம், 2 months, 3 months, patients are doing well, confidence builds. But somewhere we have to start, like building our indigenous rockets here in India. We all had to start somewhere. We did, and we are one of the leading rocket makers in the world. So, the future is with us.
You can take this portable thing to even remote areas.
Yes. So you can park the bus in the Himalayas or in Kodaikanal. Because patients can come, get the consult, do a video communicate, confirm the problem, and then have the surgery. There will be a local surgeon. There will be a surgeon. As I said, he can safely do it. He may take one hour, but the expertise can do it in half an hour or 15 minutes. It's better for the patient.
The portable system is like ambulance.
Yes, bigger ambulance.
Bigger ambulance.
More technology.
More technology. Inbuilt.
Sir, doctor, this is going to be extended only with the 75 branches of Apollo Hospitals, or you're also going beyond that to any private hospital?
So that is the future, because see, I believe that surgical expertise or any expertise is hard to develop and evolve. Once you have it, then you can build as a vertical for the network hospitals and in the non-network hospital. There may be a hospital which is, say, urology predominant service, but they can have rectal cancer. The patient can't come out, they will have to use somebody who may not be as experienced. That's where we could tie up with them and do leave the revenue, but the expertise can be extended. And money can be saved for that patient, because they will have. See, the point is to get the best out of it. How can we deliver it? So it opens up multiple channels of envisioning what can be achieved, how it can be achieved. As my chairman always says, first think about the idea and execute it. It's not going to be perfect, but it has to be executed. Then you will learn what went wrong, how can you correct it, how, you know. So, you know, that is a very important thing, because you wait for the perfect product, perfect thing, it may take 10 years. But if you go test it in a safe way, you may build a program which can be fine-tuned and change slight course correction and build something which is just phenomenal for this country. Sorry? Oh yeah, that is stage level, my club with the best.
So when you compare
Sir,
to
in-
India, UK, US, how they are doing, sir, the telesurgery?
So not yet.
Not yet.
China is doing,
Oh, US, UK, they're not done it, sir.
not yet.
Okay, India is the.
India is way ahead, China in this part of the world.
Oh, super, sir. Very good.
We are leading, and I think our Indian-made company is leading the way in
Oh,
many
super.
ways. And I think that nothing like this exists in the world.
Cost-wise, how the patient will be benefited?
So using the Indian-made system, it is 1/3 the cost of the market leader. Of course, there are some differences, but I believe that if we push the envelope and we start using more and more of it, it can deliver a fantastic service. Yes.
So to answer your question, as I said it earlier on, this is one new technology amongst many that India is leading the way on by far. And I think it's leading the way on it because it has understood the value behind this type of technology. Europe and the US have been slow to understand the benefits and the value of this technology at the moment. Some because of culture and mindset, and some because of perhaps resource. But India is by far leading the way in telesurgery and leading the way in how this can be used to the benefit of patients. And I think because of that, companies like Mantra should be very proud, you should be very proud, the programs that Apollo have set up and supported should be very proud. Because at the moment there's nothing like this that sits in someone's outpatient clinic anywhere in the world that I know of.
For all problems can be one console is supported
Yes.
for all, the gallbladder or anything.
Yeah, of course. Technology is, I think in the future, many platforms will come, but I think we are way ahead compared to a lot of systems available. And the kind of cost which we are delivering from this Indian-made robot is phenomenal. And I think it's something which we should be very proud of. Okay?
Okay, doctors will be available.
Thank you.
Okay.
I can give you a bite and then we can have some lunch. Thank you so much for coming.